Hi there, my name is Rebecca McCall. The following is a teaching lesson plan about atrial fibrillation. I hope you enjoy. The objectives of this lesson are as follows. After this lesson, each student will be able to describe the basic pathophysiology of atrial fibrillation. They will be able to identify the possible causes of AFib. They will be able to compare and contrast the different medications given for AFib. They will be able to explain the different mechanical treatments for AFib, and they will also be able to apply what has been learned about atrial fibrillation to their nursing practice. There are two main teaching theories that are included in this lesson plan. The first is the social development theory. This theory will be used in the lesson by using role play and the jigsaw strategy. The social interaction used during these activities will help develop students' cognition. The self-directed learning theory is also used. This lesson uses the self-directed learning theory through the flipped classroom technique. The flipped classroom gives the opportunity for students to learn the topic on their own prior to class. Now remember, students, in this class, I often use the flipped classroom technique for teaching, and this lesson is no different. So be sure to review the following materials prior to coming to class. Make sure you read Chapter 7 in your textbook. Review the two articles that are listed. Please thoroughly explore these two websites, the first being the Mayo Clinic, the second being heart.org. Each one contains excellent information on AFib. There are 3 YouTube videos listed here I'd like you to review as well to be prepared for class. Okay, students, so now I'm going to review some of the information you should have already learned during your research prior to class. This is a PowerPoint presentation that you're welcome to take notes on, but hopefully it'll just be a quick review. So first I'll be reviewing the pathophysiology of AFib. In atrial fibrillation, the heart's atria and ventricles are beating asynchronously. The atria experience chaotic electrical signals that result in an irregular heart rhythm that does not effectively pump blood. AFib may be paroxysmal or paroxysmal, which means it comes and goes. It may be persistent, which means it's happening often, or it may be permanent, which means somebody is always in atrial fibrillation. Symptoms of AFib may include weakness, fatigue, shortness of breath, chest pain, palpitations, or the patient may not feel anything at all. The picture here shows a heart that's beating in normal sinus rhythm and the conduction that's happening and the actual EKG pattern with a normal P wave, QRS, and T wave. The second picture is of a heart that's experiencing AFib. You see the abnormal impulses from the electrical system in the heart and the irregular heart rhythm that's shown on the EKG. Some causes of AFib include the following: hypertension, heart attack, coronary artery disease, an abnormality in the heart structure or the heart valves, including congenital heart defects from birth, an overactive thyroid gland or other metabolic imbalances may cause AFib, exposure to stimulants such as medications, caffeine, tobacco, or alcohol, an improper functioning of the heart's natural pacemaker, such as sick sinus syndrome, may cause AFib, lung disease, previous heart surgery that's changed the structure of the heart, viral infections, stress from surgery, pneumonia, or other illnesses. Sleep apnea can cause AFib, and there's also something called lone AFib, which seems to have no real cause at all. There are 2 major complications that may happen from atrial fibrillation. The first is a stroke. In AFib, blood may pool in the atria of the heart, which may lead to the formation of a blood clot, and that blood clot may dislodge and travel to the brain, causing a cerebrovascular accident or a stroke. The other potential major complication of AFib is congestive heart failure. In CHF, the heart does not efficiently pump blood into the body. The patient may experience shortness of breath because blood backs up into the pulmonary veins, which then can cause fluid to back up into the lungs. The body and brain are not receiving oxygen-rich blood, which may then cause physical and mental fatigue and reduce stamina. Fluid can build up in the feet, ankles, and legs, leading to edema and weight gain. There are three main categories of medications that are given for AFib. We will be using these medications in a role play in a minute here after we go over them. So the first type of medication given for AFib is for heart rate control. These medications include beta blockers, such as metoprolol or carvedilol. Digoxin is given for heart rate control, and calcium channel blockers are also. The goal is to keep the heart rate under 100. That's considered controlled AFib. The following antiarrhythmics are also given sometimes to help try to convert a patient from AFib to sinus rhythm, or given to help keep a patient in normal sinus rhythm once they've been cardioverted or converted into sinus rhythm. The first is dofetilide, which is Ticasin. The second is flecainide. The third listed here is propafenone, which is also called Rhythmol, amiodarone, and also sotalol, which is also called Betapace. When patients are in AFib, they often need to be anticoagulated just to help prevent blood clots. So the blood is thinned so as not to create that pooling effect or a clot in the pool of blood in the heart. So two different types of anticoagulants can be given. The first is warfarin, which is also called Coumadin. The second category is referred to as NOACs, which stands for novel oral anticoagulants. These medications are newer, but they're very effective. The first listed here is dabigatran, which is also called Pradaxa. The second is rivaroxaban, which is Xarelto. The third listed here is apixaban, which is Eliquis. And the third is edoxaban. So in this role play activity, I want the class to divide into groups. So go ahead and get together into a group of about 5 people, 5 students. Okay, thank you. Each group then will be given a medication category. So it looks like we have 4 groups of 5. So I'll go over in a minute here what the groups will be presenting, but the role play scenarios will be that of an education scenario from a provider teaching a patient and their family about each of these meds. This scenario should include the medication's action, their dosage, side effects, educational points, potential interactions, contraindications, etc. And most importantly, the reason that it's considered as a treatment for AFib. Be creative, but cover all the material, please. You'll be presenting this role play to the class, and afterwards we will be debriefing on each scenario. So group 1, we will be presenting on rate control medications. Group 2 will be presenting on role play on the antiarrhythmic medications. The third group will be presenting on warfarin, and the fourth group will be presenting a role play about NOACs. So go ahead and divide up and get working. So those role plays were awesome. Well done for everybody. I hope that you learned something about the different medications. So next we're going to be going over mechanical treatments for AFib, which we're going to be using the jigsaw method shortly here to learn more about that, but I'm just going to do a quick overview. The first option is a cardioversion, which is an electrical current that's given externally to the heart to help convert a patient from AFib to normal sinus rhythm. A shock is delivered to reset the heart's rhythm. A catheter ablation may be performed to treat AFib. The catheter's tip will cauterize the heart tissue that's causing AFib. Scar tissue then forms, which then can help electrical signals to return to normal. So that's the second type of treatment. The third treatment is called a maze procedure. This is done during open heart surgery. A scalpel, radiofrequency, or extreme cold called cryotherapy is used to create scar tissue that then interferes with AFib, causing electrical impulses. The fourth treatment is called a AV node ablation. A pacemaker is then inserted after the procedure because a catheter delivers radiofrequency energy to the AV node, which destroys a small amount of heart tissue. This prevents abnormal signaling, but a pacemaker is necessary to help the heart's ventricles beat properly because the atria is not sending the signal to where it needs to go. The third treatment is more of a treatment to help prevent blood clots from forming, and this is a left atrial appendage closure. Sometimes it's done during surgery. There's something called a Watchman's device that's kind of deployed to help remove the left atrial appendage. And often people that have had this procedure done, they don't need to take blood thinners anymore. So that's a very positive experience for patients. So in this jigsaw activity, the class will be divided into equal groups of 5. So that's 4 groups of 5 again. Each group member will be assigned a topic below, which includes the first group has cardioversion, the second group has catheter ablation, the third group has the maze procedure, the fourth group has AV node ablation, the fifth group has the left atrial appendage closure. So each member of your group of 5 will have one of those topics. The class will then be redivided into specific topic groups, and each of those topic groups will research their topic thoroughly together and develop a teaching tool that the students will bring back to their primary group. That student is then responsible for teaching their primary group about their assigned topic. So hopefully everyone will just get a little bit more information and understand the procedures more thoroughly. So regarding assignments for this class, each student is to complete and turn in a 2 to 3 page paper on the jigsaw topic they were given. So those include the mechanical treatments for AFib that we just discussed. So just a summary, 2 to 3 pages. Make sure to include your references, please. Each student will also be assigned a group wiki page to contribute to for one of the pharmacologic treatments of AFib. They'll be assigned to specifically address one of the following: action, dosage, side effects, educational points, potential interactions, and contraindication. So for your group, there should be a completed wiki page with each of those details. So the following explains the way that I will be assessing each student to determine if they understand the information that I've been teaching and that you've been teaching yourselves and each other. So the first thing here is I'd like each student to do a self-reflection of their understanding of the causes and treatments of AFib. So at the end of the class, if you could just take a minute on a half sheet of paper and write down any questions that you have, anything you need to be clarified, anything you don't really understand, and just drop it in the basket that I'm holding on your way out. If you don't have a question, if you could just still please turn a piece of paper in, it can be blank, that's fine, just so that everybody kind of feels like comfortable turning in a paper and putting a question down. I'll review and just kind of see what else I need to address next class day. At the end of the class, all of you will also be asked to turn in a brief bulleted paper summarizing the causes and treatments of AFib. Because we've been talking about them so much, I hope that you've just kind of committed them to memory and they're just a part of your brain now. So if you could just kind of jot those down just to see, so I can see whether or not you remember them and understand them. The third thing here is the clickers that we've been using throughout the semester. If you could, we're going to do a clicker activity at the beginning the beginning of the class to see how well you've prepared just for this class with the flipped classroom technique. And also at the end of the class, again, I'll just be asking a few, about 6 questions or so with a clicker, and just seeing how you respond as a class and how much you're remembering. So each patient or each student will also be getting a participation grade based on their participation in the jigsaw and role play activities. So everyone did really well today, so just keep up the good work as long as I see that you're participating, whether that be with debriefing or, you know, something in the activity. You should be able to do fine with that. And also a preparation grade I'll be handing out to each student based on their participation in the student-led AFib discussion at the beginning of the class. That's really just to make sure that you're doing your pre-work. As I was going over that PowerPoint presentation at the beginning, we were kind of talking through it. So I just was wanting to make sure that everyone is participating in that conversation and understanding the materials. So that completes my teaching lesson plan on atrial fibrillation. I hope that you found it interesting and learned something. The following are my references if you would like to look anything up. So thank you.